morning, dear friends. I am Dr. Jasmeet Singh Dhingra. I am a consultant gastroenterologist and hepatologist at Advanced Gastroenterology Institute, the Gastrociti, Ludhiana. Today, I want to share a few words with you regarding NASH. So, upcoming on 10th of June is an International NASH Day. We want to make the public aware of this entity of NASH. What is NASH? By definition, NASH means non-alcoholic steatohepatitis. But in layman terms, it is simply the deposition of fat in the liver, which is followed by inflammation, that is damage to the liver. So this entity of NASH is now reaching an epidemic proportion. After diabetes, hypertension, coronary artery disease, NASH or fatty liver disease is the new epidemic. It is a non-communicable disease which has very tremendous prevalence. In the Western world, we see it in around 25% to 30% of the population. And same is the scenario in India nowadays. Initial studies in India few years back showed prevalence around 20 to 25%. But the latest studies, including the ones done in Punjab, show the prevalence reaching up to 35%. That is, 1/3 of the population is being affected by this. Why is this important? Because NASH is a precursor of liver disease. The first stage is a plain fatty liver where just there is deposition of fat. NASH is the second stage where along with fat some inflammation occurs. And then if it is not treated timely, it can lead on to cirrhosis and even liver cancer at later stages. Most of the medical interventions for NASH or fatty liver disease are there in the second stage. So wherever effective medications are to be used, this is the right stage for it. Hence, it is the necessity to make the public aware of this disease so that they do not ignore their symptoms and a proper treatment can be initiated at the right time. In present era, we are seeing NASH is now the most common cause of liver disease. It is the most common cause of any liver test abnormalities. It is also now the upcoming most common cause of liver cancer. So it is very important to treat it at the right time. Patients usually present with vague symptoms like generalized malaise, loss of appetite, some abdominal bloating, non-specific pain. And incidentally, there can be a pickup by the LFT abnormalities done for other purposes. When we examine the patients clinically, the most common sign that we see is the enlargement of the liver. And to detect it properly, we have few blood tests and a simple bedside test of fibroscan, which can tell us the stage of the liver involvement. Along with this, the thing for NASH is that since it is now reaching epidemic proportions, we have to guide the patients regarding the interventions which are important for prevention of NASH. So I usually tell my patients regarding 5 things in liver disease prevention. Those 5 things are from A to E. A stands for alcohol. Any patient, even though if they have NASH or they do not have NASH, who take alcohol should avoid it to prevent progression of the liver disease. B stands for blood products. Any person who has had a history of blood transfusion needs to be screened properly for hepatitis B and hepatitis C so that these concomitant factors in progression of NASH can be avoided. C is for complete vaccination. Complete vaccination is for hepatitis B, which is the most common preventable liver disease by a vaccine. But in the current times of COVID, we have even seen that COVID vaccination is very important in NASH patients because one, the COVID disease itself, the manifestations and liver involvement with COVID, and the treatments used in COVID all can lead to progression of NASH. So even COVID vaccination is very important and recommended for these patients. D stands for drug intake. Drugs which are abused or misused can lead to NASH, so these have to be avoided to prevent any progression. And E is the active intervention. E is the exercise thing, which patients can actively do to prevent progression of the liver disease and NASH. So this is my message to the public. Since these public health campaigns are for utility of the common man, we as an organization and multiple other organizations, they run fatty liver disease packages and NASH packages on this day. And people can use these packages and get themselves screened and tested so that timely intervention can be done. So my message to you is stay happy, stay healthy, and love your liver to stay longer. Thank you.